big picture again, you're seeing here that my issue is not necessarily just a pharyngeal airway issue. There's definitely a nasal issue, and that you're gathering that from the fact that my non-supine RDI is almost as severe as my supine RDI. That's closing the
Yeah.
weave.
Like MMA would be low on my list looking at this watch pad. If I had not, even if I had not seen you.
That's interesting. That's interesting. I have to be honest with you, I'm strongly considering doing an MMA, and I'm going to be meeting with some jaw surgeons soon. But the reason I want to do MMA is not for sleep disordered breathing, but because I feel like my tongue needs to come forward a certain amount in my mouth in order to relieve tension at the back of my neck. And I've actually been experimenting with this hypothesis the past 2 months, where all the time throughout the day, I'm basically just sticking my tongue out. Like if I'm working on the computer, walking around, exercising, I'm like this. And I find that relieves tension at the back of my neck, and my headaches have gone down almost to zero since I started doing that. So I think it's a neuromuscular thing where there's muscles that are connected to my tongue and also at the back of my neck, where as those muscles hold my tongue into my mouth and my tongue isn't able to just relax, it's causing excessive muscle tension at the back of my neck. And then maybe with some aberrant nerves at the back of my neck, maybe some extra branches on the lesser occipital nerves that are running through those muscles that are being overused. The nerves are being squeezed, and they're maybe wrapped up in some scar tissue from permanent overuse of those muscles over a lifetime, and that's what's causing my headaches. And just releasing my tongue, relaxing it forward, is relieving that.
Oh, okay. Listen, snore for me. Make a snoring noise. Like snort, like a piggy. Okay, now do this. Bring it forward. Now can you snore? Okay, yeah. So maybe an advancement would help you. I mean, I'm not, that's my cheap test.
I think it's a great test.
It's a pipe, bring it forward 4-6 millimeters doing that. But the thing is, but what's your goal?
To have no headaches.
You might get that with the nasal procedure. Typically, I don't, I always say do the nose last, but your numbers are mild and your facial aesthetics look nice right now. Turn sideways.
They're all right.
Yeah, and you got a good jawline. I mean, you're a little recessed, sure. You could use a little bit. Maybe, yeah, I take it back. You can use a little bit, but who can't? Does that make sense? I mean,
yeah, but not everyone has chronic headaches.
Yeah, but maybe you're over breathing. Maybe you're maybe.
But why does sticking my tongue out cause the headaches to go away? And I can actually feel this immediate release of tension at the back of my neck. How else would you account for that other than this being a, chain reaction of muscles that are connected to the tongue?
Yeah, but if I stick 2 Q-tips up your nose and pull it wide open, would the headaches get better? I mean, I'm just throwing it out, no?
No.
Yeah, what's your minimum pharyngeal space in the back?
I don't know, but last time I looked, I remember that the conclusion was, wow, Ron, when I looked at you, I didn't think it was going to be that bad, but it's worse than I thought.
Okay, then do another test. Take your jaw, open it, and push it back down. Does that block your breathing?
Yeah.
Okay. All right, then. Well, it's interesting. Aesthetically, you look okay. Does that make sense? But yeah, I mean, based on, those simple non-validated tests,
yeah,
it seems like you could use a little bit of an advancement. But gosh, like I said, what's your goal? What are we trying to achieve? And, what's the minimum, the least invasive way of getting there? And that's hard to tell. right
Mhm.
now,
Yeah.
because the jaw surgery is pretty significant, and you haven't even done allergy treatments yet.
Right. Right. Yeah, I guess it's all just coming down to this belief that I have that it's a muscular thing, not a breathing thing. You know, um, that even if you could pump the perfect chemistry into my body, if my mouth were closed and the tongue were held back and these muscles were activated, I would still have the headaches.
Have
That's
you worn an oral appliance, like even a boil and bite, like a my tap, that for like a week or two, to see if that makes any difference?
yes. What I've well, not one of those, but I've worn a tongue stabilizer that pulls my tongue out of my mouth in my sleep. Have you
Oh,
seen those?
the Avio,
It's a cheap
Avio.
one off eBay. It's just
Oh,
a
okay.
little suction cup, and
Yeah,
you
yeah. And
and
that
then
help?
it helps a lot. Helps a lot.
Well, yeah. I mean, if you're treating the headaches, have you seen a neurologist too? I
Oh,
guess.
I've been seeing neurologists my whole life.
And do they do any? Okay, yeah.
No, they
No
don't do anything.
SPG blocks and
They just refill my triptan prescription. Oh, blocks like nerve blocks?
yeah. Well, they can do nerve blocks through the nose and inject lidocaine and whatnot. Anyway,
Well, I've had three migraine nerve decompression surgeries. I've had surgery at the back of my neck and my eyebrows and
and,
temples.
and but does a CPAP get rid of my headaches?
Um, no, it didn't when I used it. It didn't. I felt better. I think it was improving the sleep disordered breathing, but it did not really help the headaches much. I would still wake up with the neck tension.
So I don't know if that MMA will result in your headaches getting better then.
But again, if the CPAP is just forcing air, but my tongue is still constricted and those muscles are still being activated and overused and pinching nerves, then I think logically the MMA surgery, which would relieve the tongue, could still help.
Yeah. I mean, there's data showing that patients with sleep apnea, their muscles are still in use during the daytime to help keep their airway open. And the thought is that at nighttime, they just wear out because when they're actually needing to be used, they give up because they've been working all day, versus someone who doesn't have sleep apnea may
Right.
not need to do that. It's a tough situation because you're not necessarily targeting the traditional symptoms of sleep apnea. I mean, you're targeting one specific symptom, which is a headache.
Correct.
I guess, do you, do you wake up to use the restroom at night?
All the time. And I wanted to ask you about that. I wake up 3, 4, 5 times a night to use the restroom sometimes.
Do you drink water at night?
Very little. I have to restrict it. Otherwise, it's just ridiculous.
Do you grind your teeth at night?
Sometimes I do.
Do you
Yeah.
drool on your pillow?
Yes.
Is your sleep kinetic? Do you move a lot that you're aware of?
I think so. Yeah. Yeah.
But does CPAP stop all of these things?
I haven't used it in 6, 7 years, to be honest with you. I don't remember. I still have it. Maybe I should bust it out.
What about BiPAP?
Never tried it.
Never tried it. It may be. I mean, I think you should do. I mean, we can't come up with the exact guidance here without more testing and whatnot.
Yeah.
But it might be maybe good to back up a little bit because I think you're headed straight to the ENT, straight to MMA, and I don't know if you've done some of the pre work. It's good. It's exciting.
The pre-work is you're right. But I've done a lot of pre-work though. I've done a lot
Yeah,
of pre-work. Maybe not those specific things, but
yeah.
it's just this. It's again, I just come down to this fact that when I stick my tongue out for 17 hours a day, the headaches go away, and it's to me that's like the smoking gun. I'll tell you how I realized it too. I was working out, and and I I was doing pull-ups, and I stuck my tongue out, and and then I immediately felt this huge rush of improved ability to breathe, and then also release of tension at the back of my neck. Like literally, there's like some direct link between my tongue being out and the muscles there relaxing. And then I was like, what was that? And then I just continued to replicate that for the past 2 months, and it's like not a placebo. And I've been asking lots of different people to help me come up with a mechanism to explain what's going on, and no one's ever really heard of anything like it, even though tons of people that I talk to have chronic neck pain and headaches. So I think I'm not totally alone with this potentially being related to tongue space. But then sometimes I like talking to you. It does make me feel a little crazy, like I'm really out on a limb here, you know.
Well,
I
I'm just saying that you're expecting the surgery to cause a specific outcome. It may not cause that outcome. That's what I'm saying. But if you're okay with, it'll help your breathing no matter what to some degree. If it's done properly, it should aesthetically be pleasing, and and it should be good material for the show. I mean, if anything, right?